This is Impact Healthcare.
Attention. This podcast has been disrupted.
Well, welcome to a recap episode of the Dysrupt Healthcare Podcast. This is something new that we are testing out to kind of give a preview or a post view, depending on when and what order people are listening to this. So if you're listening to it after the episode has dropped, you're going to get a sneak preview to see if you want to go back and listen to it. So I'm excited about this because I have a ADD attention span. And so I kind of try to do things like I would want it done. And so a lot of my favorite podcasts actually do this. And so we're going to start with episode with Kimberly Carlson, the CEO of US Beacon. Now, I want you to think about this analogy. Let's suppose that when you go to the grocery store and you're putting the items on the checkout counter and they're beep, 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 and they're beeping through and all of this comes. I want you to suppose that at the end of that journey, let's say you had 100 items, that you get an invoice and the invoice strictly says the total amount of your purchase. Let's just call that $250, but doesn't actually give you the unit cost of each of those items. How would you feel? I don't think you'd feel that good. Are the tomatoes $80? Did you get that BOGO? Is the cost right? I mean, just the accuracy and transparency of it. Now, I want you to suppose if you heard the rumor, have the inkling, or just have that gut feeling that a large percentage of the times you go to the grocery store, that checkout process yields to an amount on that unit cost that's wrong. Whether they charged you 17 times for that tomato that you only bought one, or they charged you $80 for an $8 item, the reality of it is the transparency along the unit cost of those individual items and the transparency with getting it before and seeing it as it's wrong and seeing it right when you're there. All of that transparency is what gives you the sense of comfort to go grocery shopping. I want you to extract that conversation to healthcare. When's the last time you studied a bill? You get this EOB after you access healthcare. Do you actually study it? Do you see what's on it? Do you see what you're charged for individual items? Do you see and make sure that you're not charged for something that you never even had done to you? Now, what if I told you basically every single invoice that you've ever gotten from healthcare providers and hospitals have an error on it? That's exactly the conversation we had with Kimberly, because US Beacon is one of the leading individual, independently owned, mission-based, let's fix this crap organizations that audits on behalf of employers who are sponsoring their health plan, audits the bills. And when we think about this, the reality of it is so many of those bills have an error on it. And most of you that are listening to my voice actually have never even looked at it. So again, back to the checkout counter, if you went to your local convenience store or local grocery store and 90% of the times you went, there was an error on there, wouldn't you pay special attention to it the next time you went? If you knew that and you could have a chance of auditing it on the back end, wouldn't you take that option? Now, let me ask you a real question. What if that grocery store didn't give you the unit cost? And when they did, if you found something wrong, they'd give you a hard time about auditing, or they'd say, hey, you bought 100 items, you can only audit a random 20 and we'll tell you which 20. this is exactly the games that occur in the health benefits space. Most of you as employers, if you are self-funded, have a provision inside of your contract that limits how much, how often, who are the vendors, et cetera, but it absolutely limits the number of line items, transactions that you and your employees pay for. It limits your ability to audit those. I mean, this is a joke. And when Kimberly told us the stories about her organization, and they've been in business, and only one bill do they ever remember being 100% accurate. So all day long, their entire company comes in and audits hospital bills, and 99.9999999% of them have some sort of error. So this is an episode that you are going to want to listen to if you're a employer who has a self-funded plan. What if I told you 2, 3, 4, 5, 6% of recovery is just the average? And obviously, the more transactions a particular bill has, i.e. your largest of large claims, your 4, 5, 6, 10, 15, 2 weeks, 2 months hospital stays, if those have the highest number of claims, then those have the highest number of potential issues to be done. And the reality of it is the employer mindset behind this, I love Kimberly's take on this, is it needs to be that leaders need to take back. And this is your money. This is no different than if you saw an error in your phone bills, your supply bills, or any other bills. The reality of it is, unfortunately, with this bill, nobody audits it. And so when you think about spending $1 million, $2 million, $10 million, $100 million, whatever it might be, the reality of 2 to 6% is a large number. It is by far a thing that you need to be looking at. So the results of this and why I think you need to, take a look at this episode and listen to Kimberly explain the process and unfortunately that the fact that this has just become normal. The mindset here is the results make this a win-win. Her company does this on a contingency basis. They only eat the food that they find and they help you recover. So they do all the dirty work. So some tricks of the trade as a, advisor who's been in this business a long time. Number one, when you are sending out RFPs, requests for proposals for your vendors who are going to administer your health plan, right in there, as a condition to win this bid, you must allow us an annual audit of 100% of our claims. If you need a template to give them to even give it and says, you're going to give us the data for no extra cost in this format, go ahead and do that on the front end of this. Imagine what this is going to do when the carriers are promising the sun, the moon, and the stars, right? We're going to be the best partner. We care about you. We're paying your dollars. And at the end of the day, then you get down to the contract review. And unfortunately, attorneys don't know what they're looking for. And so the reality of it is so many people sign contracts that limits their opportunities, gag clauses, that limits their opportunity to do what they want with their own data. So this is one of the areas that the Consolidated Appropriations Act, the CAA, helps to support, the fact that you should be able to get your data and do whatever you want with it. It's your data. It's your data. So as a condition to win this bid, you must allow us the opportunity to audit 100% of our claims. We want it in this format, and we want it on such and such a date. That's part of your RFP. You put it in the contract. And so they're agreeing to that on the front end. That's a little free piece of a consulting advice. And Kimberly, to our listeners, offers to provide some resource and valuable information. So check out the show notes, because you're going to want to click on that and get the information that Kimberly is providing so that you could see the power of using an independently owned, sitting on your side of the table audit strategy to audit the transaction that's part of your, as an employer, second largest expense, as an advisor, your client's second largest expense. And what a way to show additional value to that client and to the employees. An error on a bill is money out of their pocket too. So everybody wins, but it takes thought, it takes leadership, and it takes disrupting the status quo in order to make this a household name, a household process, and a household strategy. Independently auditing your medical plan. Check out the episode with Kimberly Carlson, the CEO of USB.